different types of talk therapy, and in this segment we will discuss the major types of psychotherapy. First, though, I want to address the commonalities and differences across these types of therapy. First of all, what's really important in talk therapy, also known as psychotherapy, is a relationship between the client and the therapist. Basically, if you're looking for a therapist, you want to make sure that you find someone who you feel like really listens to you and understands you. That relationship is very important in any theoretical approach. All psychotherapies have generally common goals. They try to reduce the symptoms of mental illness and improve their clients' quality of life. Now, exactly how they do that is part of the differences. So, one difference is who therapy is given to. Sometimes therapy is given to an individual, sometimes it's a couple, sometimes it's a family or group therapy. So that's one way of differentiating therapies. The other way is a theoretical approach. Some therapies are based on the assumption that once you understand, you gain insight into why you behave the way you do, why you react to things the way that you do, that insight will help you to understand yourself and your situation better, have more compassion for yourself, learn strategies to help you live a happier, more fulfilling life. Some therapies focus on changing your emotional reactions. Some therapies focus on changing how you think about yourself and your world and your situation. And other therapies focus just on changing your behavior, and they don't try to change your thoughts or your emotions. Those groups think that once you change your behavior, then changes in thoughts and emotions will come along naturally after the fact. Okay, let's start with Freud, because all psychotherapy starts with Freud. It was the first type of talk therapy, and Freud's big assumption was that therapy be used to help people understand memories of traumatic events that they may have repressed, things that they might be fixated on, issues that they may not have resolved in their childhood, conflicts from their childhood that may be still hampering them today. Psychoanalysis is based on insight. The idea would be that if you come to understand that you have some unresolved conflict from the past, that you can work on that conflict now and have better relationships in the future. And as you may remember, the tools that are used in psychoanalysis are many. Some of the big ones are free association. So instead of asking you what you think about your mother, a psychoanalyst might say, if I say the word mother, what's the first idea that comes into your mind? Remember, they're trying to work through the unconscious. Psychoanalysts also look at resistance. If they try to guide you to talk about a particular episode or problem, and you always resist talking about that episode or problem, a psychoanalyst will conclude that that resistance means that there's really tough stuff in there that you need to deal with. They analyze dreams, again, as a door to understanding the unconscious. They also think about patterns of transference. Remember when we talked about Rorschach techniques or the TAT? It's a psychoanalytic idea that you project your feelings and emotions onto other people. In psychoanalysis, the assumption is that you project your feelings and emotions, attachment styles from your past onto your therapist, and so you can work out transference issues. Okay, that was psychoanalysis. Next, I'm talking about humanist psychotherapy or humanist therapy, which is about as different as psychotherapy as you can get. Humanist therapy focuses on the positive aspects of being human and humankind, and it focuses not on childhood traumas, but more on current situations and current struggles. The assumption in humanist psychology is that we all have this need, this deep need to be accepted for who we are unconditionally. And so humanist therapists try really hard to get people to understand that they are valuable and that the therapist accepts the client for who they are. And that acceptance needs to be genuine and based on empathy. The goal of humanist psychology is to help people reach their fullest potential, the best version of themselves. Humanist therapy is not directed so much by the therapist. The therapist lets the person decide what the path is going to be through therapy. What the therapist does is empathize and very actively listen to understand what the person is dealing with. If you remember B.F. Skinner and John Watson, then you remember behaviorism. Behavioral therapy focuses on, again, changing your behavior, not on changing your thoughts or your beliefs or your understanding of old conflicts, just your behaviors. There are many different types of behavioral therapy. One of them is aversion therapy. If you have a habit that you don't like and you want to get rid of, then aversion therapy might be for you. So for example, maybe you want to stop smoking. Well, aversion therapists would say every time you feel like smoking, give yourself aversive stimulus, maybe a little rubber band that you snap so you have a flick onto your wrist. Here is a type of aversion therapy that's used to try to treat alcoholics. Here's what they do. They find a drug that produces nausea, produces vomiting. It makes someone sick. So if you take this medication by itself, you will vomit. Okay. What do they do with an alcoholic? They take the medication and they put it in the alcoholic's alcohol so that every time the alcoholic drinks alcohol, they become sick. So eventually you get this association. If I drink alcohol, I'm going to get sick. If I drink alcohol, I'm going to get sick. And eventually you don't want alcohol anymore because you're tired of being sick. So that's aversion therapy, which tries to eliminate the bad, unwanted behaviors. Another type of aversion therapy is systematic desensitization. This is when you want to get rid of not behaviors, but reactions. So for example, if somebody is afraid of spiders, maybe they're phobic of spiders, what systematic desensitization therapy does is to get the person calm around spiders. First, the therapy starts off with maybe say I'm the one who's afraid of spiders. Maybe I'd go into the therapist's office and the therapist might show me a toy spider on the opposite side of the room. And then the therapist would work with me to relax in the presence of the toy spider. So progressively, maybe meditate, maybe breathing exercises to get rid of the fear response. And then maybe in the next session, the toy spider would become closer and closer, and I would learn to have a calm, peaceful reaction when I see the toy spider. And then maybe I would work up to an actual spider in a box, and that might be on the opposite side of the room. And I'd be afraid to see the spider, and then the therapist would work with me to be calm so I could see the spider and have a calm response, and the spider would get closer and closer. The picture that I show you here is a slide taken from desensitization therapy that's conducted in VR, virtual reality. So you can have someone work with a spider or be near a spider or even have a spider walk on them in virtual reality. And at the same time that's happening, the therapist helps you to calm down. So what the therapist is trying to do is to stop the fear reaction every time you see the thing you're phobic of, the spider, for example. It's also very helpful for low cognitive